Codogno in northern Italy still bears the scars of its unwanted fame, the epicenter of Europe's first coronavirus outbreak. On February 20th last year, a 38-year-old was admitted to the hospital with breathing problems. He was diagnosed with the virus the following day. Head doctor Francesco Tursi recalls the horror that unfolded.
Ma ne arrivano due, ne arrivano tre.
We heard about 1, 2, 3 cases, and we were immediately submerged with patients with serious breathing problems. They couldn't breathe. We didn't even have time to think. This literally changed our lives.
Tursi himself caught the virus days later and spent a month in the hospital. As cases multiplied, northern Italy went into lockdown. It was too little, too late. In the following days, several European countries reported new cases. By the time the World Health Organization declared a global pandemic on March 11th, Spain, France and several other European states had imposed lockdowns. But Britain held off, delaying its lockdown for 2 more weeks against scientific advice.
Had we introduced lockdown measures a week earlier, we would have reduced the final death toll by at least a half.
Britain would suffer the highest coronavirus death toll in Europe in 2020. Its economy was also among the worst hit, shrinking by 10%.
The UK is really a great example of this notion that when you try to choose between public health or the economy, you lose both.
In Turkey, doctors accused the government of trying to hide the true scale of the pandemic as hospitals filled with patients. Russia was also accused of a cover-up, with doctors claiming the true death toll was likely 3 times higher than the official total of 57,000 deaths in 2020. As lockdowns continued into the summer, governments across Europe pumped billions into their economies to try to keep businesses afloat and people in jobs. Public debt soared. But as a bleak 2020 drew to a close, science offered hope. Medical trials showed that several vaccines offered remarkable protection against COVID-19, with Britain the first Western country to roll out a mass vaccination program.
We cannot underestimate the scale of achievement that this has been, to go from the identification of a new virus and sequence it only in January of 2020 to 11 months later having a number of safe and extraordinarily effective vaccines.
Dangers lurk ahead. Infections remain high, and there are fears over new, more resistant strains of the virus circulating in Europe. Back in Codogno, Dr. Tursi is still treating coronavirus patients. Like hundreds of thousands of other frontline workers, Tursi risked his life to help others survive. The pandemic has changed life in countless ways, and it's not over yet. Henry Ridgwell for VOA News, London.